Hey guys, this is Dr. Dorsa from Pro Performance Chiropractic in Denver, Colorado. Today I want to run through my favorite self-assessment for the shoulder and hopefully give you a better understanding of good pain versus bad pain and when it might be a good idea to get it checked out by a professional. Even if you don't have pain at all, keep watching. This is one of my favorite mobility exercises to help improve my active range of motion on a daily basis. Now, I want to introduce one concept before we get into the shoulder assessment: closed angle pain versus open angle pain. So I'm going to show you on my neck because it's a little bit easier to understand than it is the shoulder. If I take my neck to the side, I'm creating a closed angle on this side and an open angle here. So closed angle pain typically indicates a joint issue, meaning that we can help that with adjustments or deep capsular stretches. Versus the open angle side, the limiting factor is muscle tissue. So things that can be helped with soft tissue therapy or massage, things like that. So we're gonna run into the gym and I'm gonna show you a self-assessment for the shoulder. This movement is called a controlled articular rotation, or CARS for short. What that means is we're basically taking our joint through its full range of motion. Some of us may have really awesome ranges and we can get that full circle. Others of us might just be out here, and that's okay. We're just working with what we have. If we feel any sharp points or pinching points, that's something to mentally note for our assessment. However, that's not something that we're going to be driving more range of motion into. So I'm going to zoom the camera out and show you a full controlled articular rotation. We're going to start by creating some tension into the body. That tension is what's going to help us drive further into the motion. And if later we want to turn this into an exercise, that's what's going to help to increase our active range of motion. So we'll start by taking a big breath in, and we're going to pack that air into the belly. Then we're going to squeeze our glutes together and then drive the feet into the floor. I'm going to take my arm out and cover with the other. From here, I'm pushing up into the arm to create some tension. I'm going to hold that tension as I let go and allow it to come up towards the sky. Once I hit my full range right here, I'm going to punch into the sky and drive back a little bit further. When I can't go any further with that motion, I'm rotating all the way out into internal rotation. So not just the wrist, but also the shoulder joint. And then I'm going to continue on back and continue to rotate the whole time until my thumb is behind me. Now, reversing that, I'm going to take my thumb, I'll drive it straight back. When I hit that first roadblock, I'm going to drive up a little bit more, trying not to lean forward. I'm rotating all the way out now, and then I'm squeezing in towards my head, and the motion is done here. So I'll show you from the side. Same thing, thumb is going to be facing forward, all the way up. When I hit that first roadblock, rotating all the way out, continuing on back. And then same thing, reversing it, thumb behind me when I hit that first roadblock, rotating all the way out, and then squeezing in towards my head. I'm going to talk about tension one more time. If we're wanting to turn this movement into an exercise or a daily activity to increase our range of motion, we really don't need to add weights. Our tension or our intensity is what's going to be the equivalent of adding weight to the bar. So I can get a Cirque du Soleil athlete who's extreme range of motion to work just as hard as your 90-year-old grandmother, sheerly based off of effort. So things that I like to add to increase our effort are a ball, something that you can squeeze into, and a rig. So a rig is going to be there to keep you honest. Let's say we're coming up. The big tendency is to lean backwards rather than using your shoulder to create that motion. The ball is just something to squeeze into to create a little bit more tension. So rep might look like this. Sometimes I'll hold my breath. And I'm really driving into it as long as there's no pain with it. And then I can rest, take a break in between reps. We're shooting for 3 really, really good reps versus 10 really fast reps. With these, you might get sore, you might get sweaty. The intention is to work hard with these. If you're feeling sharp pain or pinching throughout this movement, especially in the overhead position or into that closed angle side, that could indicate that there's something intrinsically wrong with the joint. That might be a good time to get it checked out by a professional. If you're just feeling tightness or tension in the open angle side, that's okay. That's something that you can work out with rolling or stretching, things that you can do on your own. If you like this video, please subscribe, like, and comment. I just started uploading these videos and will be doing so weekly.